Mackey, Public Information Officer for the Washington State Department of Health. We are going to have a brief update from each of our panelists, and then we'll move to Q&A. Our panelists today are Dan Klein, Senior Research Manager at the Institute for Disease Modeling, Lacey Fehrenbach, Deputy Secretary for COVID-19 Response at the Department of Health, and Dr. Jeff Duchin, the Health Officer for Public Health Seattle and King County. Oh, and it looks like we've got Jeff. Jeff, let's do a quick audio check with you when you're ready.
Okay, thanks. How's this?
We've got you.
Perfect, thank you.
Okay, fantastic. All right, so for our Q&A at the end of the remarks, as mentioned in the advisory, we will call on and unmute individual reporters who have submitted a request to ask a question. If you would like to ask a question, you can still email us to be included on the list. The email for that is doh-pio@doh.wa.gov, and we will get through as many of the question requests as we can. Please note that we will only be addressing questions about schools during this time. I am going to go ahead and turn it over to Dan to begin.
Great, thanks, Christian. So today I'd like to introduce our new modeling report. It's entitled Maximizing Education While Minimizing COVID Risk, Priorities and Pitfalls for Reopening Schools. We're using our agent-based model to simulate various school reopening strategies to evaluate health risks and days in-person schooling lost. And just like our previous report, Schools Are Not Island, released in mid-July, we learned a lot about these potential scenarios for reopening schools. So in that first report, we found that there is a pathway to reopen schools, but it depends on two things. The first thing is that the community has to do its part. We need to lower transmission in the community to be able to start to think about reopening schools. And the second part that we found in that report was that schools also had to do their part. And so we had considered various scenarios. We had considered non-pharmaceutical interventions like physical distancing, like hand hygiene, like masking. We had also considered structural factors like cohorting kids into smaller groups, as well as screening, testing, and tracing. And we found that if those interventions were in place, along with reductions in the community, that there might be a pathway to reopening schools without triggering growth of COVID-19 in the broader community. So this new report has many improvements on that first report. For example, we're now able to model staff in schools. The modeling is still tied to King County. We're simulating on the King County demographic, but we're a little bit less tied to King County in the terms of the specific numbers of tests and diagnoses down here. Additionally, this report adds a number of new modeling scenarios. We're now considering a phased-in approach where you might start just K-5 elementary first, or you might start elementary and middle schools first while keeping high schools remote. We're also now able to simulate the day of the week, and that allows us to simulate hybrid, like A-B scheduling. So this is where you would divide classes into two groups. The A group might attend in-person school Monday, Tuesday. The B group might attend Thursday, Friday with school cleaning in the middle. Whereas in the last report, we had considered various mobility levels to characterize how much transmission was happening out in the community. And now we're just directly looking at the effective reproductive number. And one thing I want to say right up front is in these modeling scenarios, we're simulating a slowly declining epidemic. The effective reproductive number in this set of simulations is 0.9. We've looked at what might happen if the effective reproductive number is above 1, say 1.1, but then you're in an exponentially growing situation and just adding schools on top of that would further exacerbate growth of COVID-19. And finally, we're considering 3 different incidence scenarios. This is the number of cases cumulative over the 2 weeks before schools reopen per 100,000 population. So the 3 scenarios that we'll be discussing in the results are 20, 50, and 110 per 100,000 people. And these sort of map into the 3 buckets that DOH has laid out, kind of under 25, 25 to 75, and above 75. So on to the results. I think we've all seen that, as schools have reopened around the country in Indiana and Georgia, sometimes they have to close down right away because an infection is detected in the school setting. So we wanted to use our model to try to quantify that risk. And what we find is that school reopening is not a zero risk activity. So even on the first day of school, we find that somewhere between 5 and 42% of schools might expect to have an infectious individual arrive. Now, that's a big range, 5% up to 42%, but the majority of that is driven by what's happening out in the community. The lower end of that spectrum is when there's 20 cases per 100,000, and the upper end, the 42%, is when there's 110 per 100,000. And you can see in figure 1 of the report how this varies with the different school types and those different incidence levels. And I think this really just highlights that, we shouldn't be surprised to find an infectious person in a school, and hope that schools have sufficient plans in place to be able to detect these cases and do the appropriate quarantine as needed. The second set of results looks at what's happening to teachers and staff, as well as students within a school-based setting. And what we find is that if schools were to reopen without countermeasures over the first 3 months of school, we could expect up to 25% of staff and up to 17% of students to possibly spend at least one day at school while infectious. And those are pretty big numbers. It's a quarter of all teachers and staff and a fifth of all students. But we can take countermeasures within schools to significantly reduce those numbers. So across the different scenarios we considered, for example, the hybrid scheduling, looking at elementary and middle in person only, looking at elementary only, and then finally taking just elementary only in person combined with hybrid scheduling, those probabilities come down quite significantly to the point where we're just looking at K-5 students in person with hybrid scheduling. There, those probabilities are more like 2% of teachers and 1% of students. In this modeling result, we're not saying that those individuals are infected while in the school setting. They might be infected in the community and bring those infections into the school. Here, we're communicating the probability of there being infectious individuals in schools. So bringing back K-5 students first is both amongst the scenarios we modeled, lower risk, and that's due to the fact that we're modeling those younger kids being less susceptible. There's scientific evidence for that. We also think it's higher benefit. Those kids tend to struggle with remote learning. Of course, the simulations that have the lowest health risk also have the highest educational cost. Those scenarios that are K-5 only, potentially with the hybrid scheduling, we're losing roughly 80% of in-school days. This is due to kids just remote learning, but additionally those being sent home due to quarantine. And the final set of results in this report looks sort of like what we did in the first report. It's trying to quantify the extent to which these school reopening strategies, all of which have the countermeasures from our first set of results, so distancing, hand hygiene, masks, cohorting, and so forth. To what extent reopening schools from this effective reproductive number of 0.9 might cause growth in the broader community? Are we going to be moving from a situation in which each infectious individual is infecting less than one person on average to a situation in which they might be infecting more than one on average? And generally, we find that's not the case, but we wanted to explore some variations on our simulations to see how robust this was. So in one of those scenarios, you can see in figure 4 of the report, we increased the infectiousness in the school settings. And what we find there is that this scenario with either the hybrid scheduling or the phased-in approach of bringing back elementary students first, even in that more extreme transmission setting within schools, still manages not to bring the whole community into a situation in which there's exponential growth happening. So I want to communicate there are many assumptions and limitations of this in all modeling work. A big one to say up front is that we're not modeling increased transmission due to parents returning to work or guardians going back to work as part of school reopening. This analysis is really focused on the schools and the reopening strategies. The second thing that's worth mentioning is that as students are participating in remote learning, we've assumed that they're perhaps at home doing that remote learning, not out in some congregate care setting, which may happen. So that's a real thing to acknowledge. Also worth mentioning that the hybrid scenarios, while they are lower risk due to fewer school days in person, it can be difficult structurally for parents to coordinate some of those hybrid schedules. Our model doesn't include factors such as socioeconomic status, race, or ethnicity, and we know those are important to decision making. I'd encourage everybody to go take a look at the report where we've described many of these details, these limitations in detail. So broadly, the transmission that we see in Washington State and across King County is high. It's on the upper end of many of the scenarios that we've modeled here. We're not yet at an effective reproductive number of 0.1, and the case incidence numbers are on the upper end of the spectrums that we've modeled. We see that there aren't any zero risk solutions to reopening schools, and we should expect to find infections in schools perhaps from the first day, and if not, then over the course of the school season. The elementary school only scenarios, potentially combined with hybrid scheduling, is the lowest risk, and it allows for some in-person learning, but there's considerable uncertainties here. We don't fully understand how susceptible kids are, how infectious they are, and so forth. And so these uncertainties lead us to encourage an incremental approach where we might bring back sort of the lowest risk group. If we're not seeing large clusters derived from that, then maybe expanding out. So I think consistent with the previous report, these results continue to underscore the need for just community reduction measures, which should all come together to try to figure out how to reduce COVID-19 transmission levels to be able to safely bring everybody back to school. I'll just finally remark that these results seem consistent with the DOH guidance, and I think we'll hear more from Lacey in just a minute about that. Thank you for your time.
All right, thanks, Dan. Lacey, we'll go ahead and go over to you.
Thanks. I want to start off by thanking the Institute for Disease Modeling and specifically Dan and his team for their extensive work to help us as state and local leaders better consider the complex decisions around when, if, and how to bring students back into school for in-person learning in a way that is as safe as possible for those students and the staff and the families they go home to and the communities in which they live. These are among the most complex and difficult decisions community leaders will face during the pandemic, and any information we can provide to them is helpful. As Dan mentioned, this modeling report, as well as the previous, are consistent with our recommendations and give us hope that students can return to in-person learning with lower risk for the students themselves and the staff, but only when transmission in the surrounding community is low and declining. The model suggests that a gradual return to in-person learning, beginning with younger students, would reduce the risk of transmission in schools while providing the benefits of in-person learning where it is needed most and can benefit the most. This fits with what we have learned from other countries that reopened schools successfully in the spring. These countries had a downward trend of disease and low rates of COVID in the community. They also took a really cautious approach by bringing back some, not all of their students for in-person learning at first, and implementing health and safety measures as we recommend. Unfortunately, in Washington right now, as Dan mentioned, we have too much disease in most parts of the state to open schools for in-person learning. Statewide, our case rate is still high at more than 120 cases per 100,000 over 14 days. So that is in that top scenario of, I think, 110 cases that Dan mentioned. We currently only have 6 counties in Washington that have fewer than 25 cases per 100,000 over 2 weeks. And that's the level at which the Department of Health's guidance encourages in-person learning at some level for all students. There are some hopeful signs in our state's data. New cases of COVID have plateaued and appear to be slowly decreasing. In addition, we are seeing less COVID-like illness in our healthcare system. This report shows us that we can get our kids back in school, and our health guidance and decision-making tools outline a pathway to in-person learning for all students in Washington. This is where we must all come together and continue working towards. Wearing masks, watching our distance, and having fewer, shorter, safer interactions with others is helping. It is helping us reduce the spread of COVID in our communities and across our state, and we need to keep up our discipline in doing these things so that our children and young people can return to their classrooms soon. Thanks.
All right, next we're going to go to Dr. Duchin.
Thank you. And I'd also like to add my thanks to Dr. Klein and colleagues at the Institute for Disease Modeling for helping inform our decision-making as a public health agency and as a community around this critical issue. I also just want to start by saying how much we at Public Health Channel in King County support the state guidance that recently came out to inform school reopening, and that we expect all of our schools in King County to adhere to that guidance. I find three key messages in the report that we just heard about. The first is that reducing the spread of COVID-19 in our community is the most important and effective way to reduce the risk to students, teachers, and staff, and to get our children back to school as safely as possible. And we need to do more in the community to reduce that risk and decrease transmission. Second, there will always be some risk for COVID-19 in schools, and schools must take comprehensive steps to protect students and staff, and in particular, make special arrangements for high-risk students, high-risk teachers, high-risk staff, and give the option of remote learning whenever possible if they're going back to in-person. And third, when the community COVID-19 activity decreases sufficiently to resume in-person education, it makes sense to do so with elementary students first and those who have special needs and have the greatest need to get back to in-person learning. So with that, I'm going to conclude my comments and happy to take questions.
All right, great, thank you. We are going to go ahead and start our Q&A portion. We will call on and unmute each reporter in turn. To make sure that we can hear you, please use a headset if you have one, or make sure to speak directly into the mic on your phone or computer. And each reporter will be given the opportunity to ask a follow-up question. Our first question is going to come from Hannah Scott at Cairo Radio. Hannah, you're unmuted.
Hi, good morning, everybody. Just some of the things that I've seen from the schools and these reports lately, it looks to me like it's very unlikely we're going to get high school kids back to school in person ever. Is that kind of the sense you're getting? Can you speak to that at all?
I can start. This is Lacey at Department of Health. I recognize that it seems like 25 cases per 100,000 over 2 weeks seems like a really low threshold. I want to remind people it's not an insurmountable threshold. There are counties in Washington that have rates that low. And there also were several counties, many counties, that had rates that low earlier in the summer. In fact, as we approved counties to move in phases of Safe Start, most of them were at or below that rate. So if we work really hard and come together on all of these health and safety measures, non-pharmaceutical interventions, we can do this and we can get our students back in school, including high school students.
And I would just like to add to that, this is Jeff Duchin, that, I have previously said, and I would like to really reemphasize it right now, that we fundamentally need to rethink the way we go about our lives, both in our workplaces, socially, and recreationally. We really need to take special precautions for the foreseeable future and adjust our expectations about how we will interact with one another and in the community. We very much need to decrease the number of activities that we all have in the community outside of the home. We need to decrease the proximity to others, keep social distancing of 6 feet or more, decrease the duration of contacts when we do have contacts out of the home, pay attention to ventilation and avoiding poorly ventilated indoor spaces, and wear a mask whenever in public and indoors with others that are not from the household. I mean, these are just the basics. We can, as a community, achieve low levels of transmission, but it's going to be hard. We need to make sacrifices. And I think we need to understand the long-term nature of this challenge with COVID. This next year is going to be very rough. And whether or not we will get high school students back to school in this school year remains to be seen. I don't think it's out of the question, but over time, as we make the necessary changes in how we go about our lives, as vaccine hopefully becomes available, and as we potentially get more immunity in the population from the inevitable infections that will occur, we will get all of our students back to school at some point. But we need to be patient, and we need to understand that this coming year is going to be very challenging, and we need to work together with extensive recommitment to COVID prevention in our community if we're going to be successful.
Just add briefly what we see in the modeling work is, as we bring back more and more students, that's hard to do at those high levels of community transmission. So just as you heard Jeff and Lacey say, bringing those down is the quickest way to get those high school students back in particular. What we understand from the literature is that younger kids might be less susceptible to the disease, whereas high school students are perhaps more like small adults and potentially are playing a larger role in transmission. We've seen that in some of the global examples of school reopening and outbreaks, more so in high schools than in elementary schools. The other thing is that those elementary schools are sort of naturally cohorted, and in our modeling, we're capturing those bubbles or cohorts of students, and we find in the model that that's able to reduce the spread of transmission and further facilitate if contact tracing needs to happen, we'll have an easier way to understand who those infectious individuals might have been in contact with. That's potentially harder to implement in some of the high school settings.
All right, thanks everyone. Hannah, did you have a follow-up? All right, hearing nothing from Hannah, we will go ahead and move on to our next question, which will come from Ariel at the Spokesman. And you are unmuted.
I think my question is for Dr. Klein, but anyone who wants to chime in definitely can. I'm curious how applicable this report is to other counties and other school districts, and sort of how you recommend other school districts and health districts sort of use this model going forward.
Great. Thanks for that question, Ariel. So there are parts of this model that are very King County. As I mentioned before, we're using the King County age distribution, so the age of the population matches King County. Simultaneously, the network structure. So within this model, people have contacts. Those are the people that they might infect. And so we've built those contacts based on employment data, based on household structure data, based on school enrollment data, and looking at the age distribution of staff. All of that comes from King County and Seattle in particular. But what we're not doing in this report is to look at detailed epi data. We're not looking at the daily numbers of tests and diagnoses and hospitalizations and deaths in King County, for example. And so I think the way to generalize these results would be to look broadly at things like those effective reproductive number, looking to see that in a gradually declining epidemic, looking at those case incidence rates, keeping in mind that testing really matters as well. As we test more, we might find more cases. So broadly, I would encourage sort of roughly looking at these, but with an understanding that there are some King County specific things here, and perhaps rural populations with different employment rates and different age structures, the results might be slightly less generalizable.
Thank you. And I guess as a follow-up, do some of these principles apply to university settings as well when we're talking about, cohorting students or students meeting in person? How much of this do you think can apply to some of those higher education settings?
No, it's a good question. In this report, we haven't taken steps to specifically model the university settings, but you could imagine the same kinds of countermeasures, the non-pharmaceutical interventions, as well as trying to keep the number of contacts small would be the same kinds of interventions that you might implement in those settings. I don't know if Jeff or Lacey, you have more thoughts on universities specifically, but it's not something we've modeled in detail in this report.
Well, this is Jeff. I would just add that we've already experienced a large outbreak at the University of Washington in the Greek system. We know that there is a great potential for COVID-19 transmission in the university setting if precautions aren't taken to decrease the interaction of students. And we know that it's a challenging environment because university students like to socialize. That's one of the great things about going to college and university is to get together with your peers and have a good social experience and to grow your social networks and to connect with other people and faculty. So we would expect, or I would expect to see significant transmission on university campuses if precautions aren't taken to limit in-classroom activity and out-of-classroom activity. And we're hoping that our universities take advantage of the opportunity to use virtual learning to the greatest extent possible. I mean, as you've seen recently, many of the sports leagues have canceled competition this fall because of concerns about COVID-19. And again, I just really can't emphasize enough the issue of uncertainty, that this is a new emerging outbreak. We don't know the long-term health impact of infections in younger people and young adults at this point. We do know that although they appear to be at much lower risk than older adults and those with underlying health conditions, they are not immune, and they are not immune from severe infections and death. So we are very concerned about protecting the health of the students themselves, the faculty, and the surrounding community. And I just urge caution in this first season of this new emerging infection as we learn more and how we can go about doing things safely. Lacey?
I think Dr. Duchin covered this very well, as did Dan. I think the other thing I would add is, university students are a little more mobile also than younger students that are in K-12 typically. And, again, this is uncertain. Like, this is something we haven't gone through as a state, nation, or world in more than 100 years. So a cautious approach is a very wise approach.
All right, thanks everyone. Our next question is from Nick at Como.
Hi there. Thanks so much. I was wondering, when it comes to getting the kids back to school, do you think it's going to have to take a full shutdown to get us back into these schools? Because I know we mentioned that the 25 per 100,000 was attainable, but that was back when we were completely shut down, or at least close to it. Do you think it's going to take that for us to get back to those ideal numbers?
Dan, why don't you take the first crack at that one?
Yeah, I mean, a shutdown would be one way to get there, but I think a shutdown would have, again, pretty significant economic consequences. So what we have seen by looking at some of the data from across the state is, while we are at levels that are fairly high right now, some of the recent masking policies, we think, are driving down some of the numbers. We see this because as we've looked throughout the course of the epidemic, as we've watched the different measurements move, one of the early indicators was mobility. As we saw that first lockdown, we saw people who could stay home were staying home, and that was associated with reductions in transmission. What we see now is a gradual return to mobility. People are going back out to work, back into the community, and so forth. But some of those levels haven't changed very much over the past month or so, while at the same time we've begun to see reductions. So looking around the state, Yakima is a very good example of this, of where they had a strong masking initiative, and now it's gone from one of the hardest impacted counties in the state and in the western part of the United States to being on the downturn now. So we're optimistic that we can get there Masks are going to be a part of that, but again, it's everybody doing their part. Those backyard barbecues and social settings and birthday parties and so forth are part of this overall transmission budget that we might need to save or return to schools.
Yes, and I would just like to add to that, this is Jeff Duchin, that clearly a shutdown is the most effective way to rapidly reduce transmission in the community and get us down to low levels of COVID-19 spread. We would very much prefer to see voluntary compliance with decreasing in discretionary activities. We know there's a lot of socializing going on. There's lots of parties. There have been graduation parties, weddings, social events, birthday celebrations that we're aware of. There was the Greek outbreak that I mentioned a few minutes ago. There are lots of things that are happening in the community that people are doing that are increasing the spread, and we are at levels that are too high to get back to school the way we would like to in King County currently. And we may need to impose additional restrictions if we see increasing levels of disease transmission, certainly. And I'm very concerned about going into the fall that we may be at risk for an exacerbation of our outbreak, for increased transmission, for more outbreaks in communal settings. And as people come indoors, ventilation goes down. There are reasons to believe that the virus will be transmitted more effectively in the colder, drier weather as well, perhaps. And so we really need everybody now to do what they can, voluntarily, to decrease the activities outside of the home that are not necessary. Whether we need to go back to shutdowns or not, we will find out, I think, in the next couple of weeks to months. Clearly, there are many very knowledgeable and respected leaders across the country that are calling for national shutdowns of 6 to 8 weeks to get the entire country back to a level where we can, as a country, open schools safely and get back to some of the economic activity that we'd like to do with lower levels of transmission. And here, I think in Washington State and King County, we are not seeing the extreme levels of transmission that some other parts of the country are seeing, where that would be that recommendation would probably be more necessary imminently. But I do think that we have to keep that option in mind.
Thanks so much. Yeah, thank you. I had another follow-up question. I was wondering, because hearing about the different measures to take if we get back to a point where we can have students go back to school, and I know it's the younger students who would generally, in this idea, would go in first. I'm just thinking about the teachers. Do you think this would add more stress to, say, a kindergarten teacher to try to keep social distancing between 5-year-olds? I can't imagine having to do that, nor it being probable or possible. Do you what's kind of your message to teachers as we get to this idea of potentially bringing students back, but trying to keep them with masks on, socially distant, that type of stuff?
This is Lacey. I can start. I think one thing I want to call out is that our guidance for health and safety measures in school intentionally layers interventions for this reason. So we're doing symptom monitoring to screen out people who have symptoms and are potentially ill. We are encouraging face coverings. We are doing physical distancing as much as possible, recognizing it's not going to be 100%. We want to increase hand hygiene, ventilation, indoors and going outdoors as much as possible, and really helping people who are sick stay home. So, we know that especially among the young students who are learning to wear masks and naturally attracted to each other, there's not going to be 100% compliance with either of those things. The goal here for teachers and staff in the school is to help those students learn and to layer the interventions to provide as much protection as possible.
And this is Jeff. I would only add that, again, we are learning as we go, and we need to see what is possible to accomplish at that youngest level and at every level. with respect to students adhering to guidelines for distancing and mask use and the cohorting. And we really don't know how well any of this will work at this point. We're going to learn as we go. We think the recommendations are a reasonable starting place and very important guideposts to minimize the risk to everyone in the school environment. But some of this, I would say all of this is, at this point, unknown. We don't have an evidence base, we don't have experience to judge how well these recommendations can be complied with. And that's an important thing that we're going to have to figure out as we move forward.
I'll just add briefly to that is, in order to conduct this modeling analysis, we've had to make some assumptions around how well these various interventions work. And we have not assumed in the model that they're working perfectly. Just as Lacey mentioned, this layering, the combination of all these layers together, the hand hygiene, the distancing, facial coverings, and so forth, in our modeling work, we have assumed that that results in a 25% reduction in the school setting. But as Dr. Juchin has just communicated, that is one of these uncertain numbers that we'll learn more about as we open schools eventually.
All right, thank you all. Our next question is from Joseph at the Everett Herald. You're unmuted.
Hi, thank you. I guess my first question, and Dr. Juchin, you sort of touched on this, is can you talk to the challenges that doing this ahead of a flu season presents? The idea that if we were to get cases down in Snohomish County right now, it's about, I think, in the mid 80s. Getting down to 25 and below that would take quite a bit of time, which would then put you right up to the start of a flu season. And the idea that as soon as we start opening maybe a school up, we would have to start preparing to close them down because we're at a higher susceptibility for cases there. And then a second question quickly, does the model take into any consideration the differences of a private public school in terms of school sizes? Private schools say, hey, we're smaller, we have higher ratios. We have lower ratios, we could be doing distancing a little bit better. Any idea how that would affect things?
Okay, thanks. I will start, and then Lacey will probably have something to say about this as well, and then Dr. Klein will speak about the second question. But with respect to flu season, it is a tremendous complicating factor, both because the symptoms of influenza can be very similar to the symptoms of COVID-19, which means that students will be screening for those symptoms and excluded from school, and they'll be seeking testing and putting stress on our testing capacity. And because there may be some complications that we don't know of that would result from simultaneous influenza and COVID circulation at the same time. So flu season is going to make everything more complicated. And the first thing I want to say is please take advantage of influenza vaccination for that reason. Flu vaccine is particularly effective in children, and it's very effective in preventing hospitalization and death in all ages. So everyone should seek influenza vaccination this season, in particular, to minimize their risk of getting influenza and having that confused with COVID, and also keeping them healthy. Schools should be prepared to close down. I mean, I think this is part of the message, is that COVID is absolutely going to remain a threat, and we expect COVID cases in schools. And if we have a number of cases in the classroom or a number of cases in various classrooms, schools will be closing, and this should be an expectation of the schools and the school community that schools may need to close and the virtual learning may need to be implemented at any point. The risk of that may be significantly higher during flu season, but again, it's not certain, and we will learn as we go.
Thanks. What I will add is we do give the schools and local health departments guidance about how they need to be ready to monitor and respond to suspected or confirmed cases of COVID. And as Dr. Juchin mentioned, that we should expect cases and we should expect outbreaks. So, the school has to be able to do monitoring of symptoms and history of exposure among their students and staff, and they can figure out. They have a lot of options for how they do that. That can be done through parent attestation. The school has to be prepared to manage and isolate students or staff who get ill on site. They have to have letters ready to inform families when they have a case or an outbreak. And then, very importantly, the public health system has to be able to test and contact trace in partnership with the schools when there are cases, and monitor the overall disease activity for COVID and flu. I think we are very concerned about the flu season. I will put in a very strong second to Dr. Duchin's recommendation that we all get our flu vaccines and get our kids their flu vaccines before the fall. And turn it over to Dan for question number 2.
Yeah, I want to just touch briefly on the first question because it impacts the modeling as well. It's easy in these computer simulations to just do the symptom screening part, too well. If you're simulating COVID and those individuals who have COVID are the ones that screen positive, you wouldn't really have a lot of false positives. So we've intentionally built into the model something like a seasonal flu prevalence, and those individuals will screen positive in our model. So we've accounted for that. On the school size question, we've taken the size distribution of schools in King County, and that includes both public and private schools, but we haven't split the analysis by school size in any particular way. Within the model, we're assuming approximately 21 students per teacher or something like that. As they're split into cohorts, you end up with smaller groups of students in person learning at any one time. And we do find that that is helpful in limiting the spread of the transmission, but we haven't specifically pulled out the public versus private schools in this work.
No, thank you.
Okay, great. Our next question is from Alexis at the News Tribune. You are unmuted.
You talked a bit about how schools will have to sort of see what's possible as they go forward in terms of cohorting and other countermeasures. But can you speak generally to districts across the state and just how prepared they seem to be to implement these different countermeasures? Do most of them seem ready to go with those things?
I can start. The governor's order that reopens schools, along with OSPI's guidance and the health and safety measures that come from Department of Health and Department of Labor and Industries, set the expectations that in order to open, you need to be able to do these health and safety measures. We certainly recognize that the 6 feet of physical distance is a challenge for people, especially if they want to bring back all of their students. I think, I will remind folks that we learned from other countries that bringing back all of your students at first is maybe not the safest, wisest approach. And so, like the combination of the cohorting and space and masking in particular is really most likely what is going to give us the best path forward to having in-person learning. And I know our local public health officers and departments are working as closely as we can with schools to help them get ready for this.
All right. Alexis, did you have a follow-up?
Yes, I'm wondering if there are plans for any future reports, and if so, what you plan to look at next.
We haven't specifically thought about a next report. There's still a lot to do. One direction that I'm just personally interested in is evaluating, some of the limitations of the current report, some of our assumptions that parents aren't returning to work, some of our assumptions that kids who are doing remote learning are at home. I'd like to see the extent to which some of those assumptions matter. So to really challenge those. Perhaps to explore some of the daycare settings with the model, perhaps explore a return to work, those kinds of things, but just some thoughts there, no firm plans.
All right, our next question is from Steve at Q13. Steve, you're unmuted.
Hi, good morning, everybody. Thanks so much for taking my question. Just wanted to ask, I think I might know the answer already, but the question deals with whether or not the your models take into account this new information that was discovered in, I think it was Florida, where researchers discovered that the spread of the virus could travel up to 16 feet or so. I may be off by a couple feet on that number. And I guess, you know, from a larger kind of farther back standpoint, there's so many qualifications and specifics with requirements, and you know, if this happens, then you do this and that. Is it just too? Do you think it's too complicated to even attempt getting kids back into school at this point?
I can start and speak to what we're doing in the model. So, you know, we've suspected for some time now that this virus might be able to transmit by those aerosol particles you're referring about. It gets into the air, and this is some of the recommendations around ventilation are aimed at preventing that form of transmission. Within the model, we're not modeling at that level of resolution. We're not modeling kids touching a surface and another kid then touching the same surface. We're not modeling the buildup of virus within the air in those concentrations. What we are modeling is those contacts within a school setting, and we're modeling the transmission between those contacts. And you can think of it as a daily probability. And so that probability would account for things like the combination of the various transmission routes. So in some sense, we've accounted for it, but we haven't done so at a very fine-scale mechanistic type of analysis.
This is Jeff Duchin. I just add that you know, the study I believe you're referring to is from a hospitalized patient in Florida, where they found a virus in the air that could then be cultured. But what we know that this virus does go through the air in droplets that come out of people's mouth and nose, and most of those droplets, you know, just go a short distance. But clearly, the virus can remain suspended in the air and travel farther away. The question that we really don't know at this point is how significant is that for transmission? It depends on how much, what is the infectious dose? I mean, how much virus do you actually need to become infected? Just because a virus is floating 16 feet away from a patient doesn't mean that virus can actually cause an infection in someone else. So we're still learning about that, but I would say that the preponderance of evidence suggests that it's the short range transmission that is most important in COVID-19, and that it's possible theoretically for this virus to travel further, and particularly in settings that have poor ventilation and are indoors, those particles may build up and present a greater risk. And that's why we really do emphasize, when possible, avoiding poorly ventilated indoor spaces, increasing ventilation to the greatest extent possible, and decreasing the duration of time that people spend in indoor locations with others. Because again, this virus transmits from people who look perfectly healthy, who feel perfectly healthy before they become ill. So looking at your friends and seeing that they're happy and happy to see you as they should be does not mean that they're not infected with COVID. So we really want people to understand that when they're in social situations, people who look very healthy can be excreting COVID into the air and can be rather infectious. So for that reason, we discourage unnecessary social gatherings, particularly large ones. But in the context of schools, if you look at the guidance that just came out from the National Academy of Medicine and from other very good professional associations like the American Academy of Pediatrics and others, they do recognize the importance of trying to maximize ventilation and improve ventilation in the school setting to decrease the potential for transmission from airborne particles and from droplets that can accumulate in poorly ventilated spaces.
This is Lacey, and I want to address the question you raised about, is it worth it to try? And, you know, I just want to remind everyone, like, there are immeasurable, countless benefits to child health and well-being and family health and well-being provided by schools, in addition to access to education. And so, you know, Jeff covered very well the risk and ways to mitigate the risk through ventilation. I think the question, I would reframe it as, is it worth it for all of us to be doing all of these social things? We must be working towards getting our kids in school. And the trade-off we're going to have to make are the sacrifices as adults around our social interactions. Fewer of them, shorter interactions, safer interactions. Like, that is where we need to be making our choices.
Yes, and if I can just follow up, I'm sorry, but this is a really important topic. And I just would like to also add that, the decision to bring children back for in-person learning is probably the most difficult decision that we're facing in the context of this COVID-19 epidemic. And it really needs to carefully consider the risks and benefits of schooling, both to children and to the staff, the teachers and the staff in the school, and to the community, and needs to weigh the importance of education and the values of that community in making this decision and understanding the risk that they're willing to take. Because we've said before, there will be risk at any level of transmission, and the need of the various types of students, the youngest, those who have special needs, children who need school, those needs are great. And they need to be balanced against the potential risk, and we need to do everything we can to minimize that risk. But we do need to consider the input of all the stakeholders in making these decisions.
All right, Steve, did you have a follow-up?
No, thanks so much, everyone.
Okay, our final question is going to come from Austin at KHQ. You're unmuted. All right, sounds like we don't have Austin, so we will move on to Elizabeth at the Sunnyside Sun. Hold on one second. And you're unmuted.
Good morning. So I'm from the Yakima Valley, and the recommendation is to go remote for moderate to high risk communities, and we're still within that threshold. However, there are some small populated schools that have decided to go fully in person in this area. And I was just wondering, what can we say to those schools that have decided to go almost against the recommendations of the governor in order to provide the needs for the child, if that makes sense?
So the guidance does set mileposts, guideposts, as we described, for local decision-making. We hope that that decision-making happens jointly between schools and local public health, and would encourage that if you take advantage of the flexibility to bring in a small number of students for in-person learning, if you're in the high activity level, which most counties in Washington state are, that you do so extremely carefully and cautiously. Of course, you have to follow our health and safety guidance, and there's a checklist for that on the decision-making tool. But in addition, we strongly, strongly recommend that any learning in person take place in small groups, 5 to 10 kids at a time, and that you strictly cohort.
All right, Elizabeth, did you have a follow-up?
No, thank you. I feel like most of these questions that I've had have been answered, and it was very thorough and very insightful. I really appreciate the work that all of you have done to help us voice the concerns to our community. So thank you so much for allowing me to ask a question.
All right, we have only a couple minutes left. So I will just go to our panel members and see if there are any final thoughts they would like to share before we conclude.
I guess I can start. I just would say that this modeling is one tool. I don't think it provides all the answers. I'd again encourage everybody to take a look at the report so you can better understand some of the assumptions that we've made, as there are real uncertainties here. We've made some assumptions around how infectious children are, how susceptible they are, what the structures of these school classrooms would look like, and what might be happening to kids who aren't in an in-person learning setting. So please take a look at the report and feel free to reach out to us if you have additional questions.
I want to thank you all for your excellent questions and attention to this really important, challenging issue that our state is, and many communities in our state are moving through, and just ask the public to stay with us on wearing masks, watching your distance, and having fewer, safer, shorter interactions with others.
And this is Jeff Tuchin. I'd like to echo that and just remind everyone that the most important thing that we can do to get our children back to school and to protect the safety of our students, teachers, and staff is to get the levels of COVID-19 spread in the community as low as possible. And we all need to step up and understand that everything we do as individuals impacts what happens in our community, and that the activities that we choose to take in our personal lives have an impact on the things that we can or can't do in places like schools and in businesses. And so please do everything possible to limit unnecessary activities outside the home. Take precautions to make sure appropriate 6 feet of distance is maintained. Wear a mask when in public. And we'll get through this year. This outbreak isn't forever. It's going to be time limited, and this is going to be a very difficult year. We need to think carefully about how we can all work together to decrease the risk to our most vulnerable, including our children in school settings, and things will improve over time. But this is really an important time for all of us to reboot our commitment to decreasing COVID-19 spread in our community.
All right, thank you all so much. That concludes our briefing for today. If you have more questions, you can follow up with us by email at doh-pio@doh.wa.gov or using the contacts listed in this morning's news release. Thank you all.